Millions of U.S. workers are losing their health insurance as a result of massive layoffs due to the coronavirus pandemic. The Economic Policy Institute estimates 11 million people may have lost their employer-provided coverage in the last 5 weeks. Without insurance, the cost of treating COVID-19 can cost thousands of dollars. For more, let's bring in Josh Bivens. He's the Director of Research at the Economic Policy Institute. Josh, thanks very much for being with us. How does this figure of 11 million people compare to the monthly average before the coronavirus outbreak, and how did you arrive at this number?
So compared to sort of pre-coronavirus outbreak, in sort of a 9-year period following the Great Recession, we saw jobs added every month. And so that means the best estimate for people getting employer-provided health insurance was a small increase every month. But then the job market just has gone into complete free fall. In the past 5 weeks, we saw 24.4 million people file new unemployment insurance claims. And we estimate of that 24.4 million, we looked in 11 states that provide data on what industries those layoffs were concentrated in. And then we looked at the share of people in those industries who get employer-provided health insurance and tried to use that to sort of infer what the overall loss for the nation was likely to be. And our estimate is about, through last week, it was 9.2 million workers who had lost their employer-provided health insurance. Then we saw another 4.5 million people file new claims. So I think 11 million is probably the best estimate now for the number of people who've lost their employer-provided health insurance.
So not everyone who loses their job files for unemployment insurance. Why is that, and how did that factor into your data?
Yeah, so not everyone files for unemployment insurance. We actually will have some estimates a little later this week on the number of what we're calling kind of frustrated unemployment insurance claims, people who, called or went online or even tried to visit the office to file an unemployment insurance claim because they lost their job and couldn't. And our best guess is that 24.4 million number is probably underestimating by a good 10 to 20% the number of people who have actually lost their job over the 5-week period. So yeah, I think our number of employer-provided health insurance could definitely be an understatement. We just don't know how many people have been laid off over the past 5 weeks and just have had no success at all in getting into the unemployment insurance system.
So what options are actually available for people who have filed for unemployment insurance?
So in terms of just wage replacement, there was a big expansion to the unemployment insurance system passed as part of the CARES Act. Gosh, I don't know if it was last week or the week before. Time is moving quickly. This not only expanded the universe of people who are eligible for unemployment insurance, like gig workers and some independent contractors. It also expanded the criterion through which you could qualify. You didn't just have to be laid off. You could also say, for example, need to be home with a sick relative or be caring for a kid whose school is shut down for the coronavirus. And the weekly benefit was boosted by $600. So in terms of wage replacement, there are some options. In terms of health insurance replacement, there's not a ton of great options. I mean, people can go into the Affordable Care Act health insurance exchanges. That still requires a out-of-pocket premium payment for people. They'll get a premium subsidy, but in the short run, they're going to have to pay premiums. There's some states, they might qualify for Medicaid, but there's still about 14 states that haven't done any of the Medicaid expansions that were part of the Affordable Care Act. So it's a pretty patchy safety net for people who've lost their employer-sponsored health insurance coverage.
So you touched on this a moment ago, but which industry is being hit the hardest with unemployment insurance claims?
So the first ones are ones that you kind of expect. Lots of accommodations and food services, the restaurant workers that have been shut down, the hotels, the travel industry. Retail trade is overly represented in those. Somewhat surprisingly to me, in the first 4 weeks, construction was a big share of unemployment insurance claims, but those are the big ones.
So the Economic Policy Institute has proposed that the federal government step in to help these millions of people who have lost their coverage. So what actions, in your view, should the government be taking?
So if you layer them from sort of the least ambitious to sort of the most ambitious, I think you would go, the federal government can create what's called a special enrollment period for the Affordable Care Act exchanges. Basically, if you lose your employer-provided health insurance, you are entitled to go into the Affordable Care Act exchanges, but you have to do some paperwork and jump through some hoops to prove you've had an insurance status change. We could waive that. We could just say it's a crisis. We're going to assume people newly trying to get into the ACA exchanges belong there and reduce that sort of bureaucratic burden from getting in the exchanges. The federal government can do that. For about the 12 states whose exchanges it controls, you could also imagine the federal government stepping up to pay some of the COBRA premiums. When people lose their employer-provided health insurance, they can often continue to stay on their employer's insurance plan if they pay for it all out of pocket. It's very expensive. Having the federal government pick up that for a couple of months can help a lot. And you could also just have the federal government try to expand the existing public insurance plans like Medicare and Medicaid. Just create special branches of those plans and say people who lost their employment due to the coronavirus over the next 6 months get to slide right into those plans, and maybe we'll figure out how to integrate them back into our normal health insurance system later, or maybe we'll just expand those public plans permanently.
Yeah, it's just so clear that there are so many people right now who are in dire need. Josh Bivens with the Economic Policy Institute. Josh, thank you very much.
Thanks for having me.